We are in the midst of the summer season, so I wanted to share two recent articles that were published related to climate and environmental health. So, both of these articles were published in the May 2023 issue of the American Journal of Public Health. And the first that I wanted to share is called Wildfire Threat to Inpatient Healthcare Facilities in California. So, the researchers wanted to assess wildfire risks to California inpatient healthcare facilities. So they mapped that onto in relation to fire threat zones. So what they found was that about half of California's total inpatient capacity is within about 0.87 miles of a high fire threat zone, and about 95% is within about 3.7 miles of a high fire threat zone. So definitely wildfires threaten a large number of these inpatient healthcare facilities. So the researchers recommend that policies should address facility level preparedness, including smoke mitigation, sheltering measures, evacuation procedures, and resource allocation. And then regional evacuation needs should consider access to emergency medical services and patient transportation. So I found this particular article interesting, not only in terms of thinking about wildfire risk, but also other types of disasters and emergencies, including flooding, which is a little bit more relevant here. The other article that I wanted to share is on planning to reduce the health impacts of extreme heat, a content analysis of heat action plans in local U.S. jurisdictions. So the researchers wanted to examine commonalities and gaps in the content of local U.S. heat action plans designed to decrease the adverse health effects of extreme heat. So what they found was that all of the plans that they evaluated provided data on activation triggers, heat health messaging, and risk communication, cooling centers, surveillance activities, and agency coordination. And most of them did include information on outreach to at-risk populations, but there were still some gaps. And so what they recommend is focusing on increasing targeted strategies for at-risk individuals and expanding the use of surveillance data outside of situational awareness. And there are a couple of interesting graphs and tables and figures that they included, the first of which is this kind of geographical distribution of the different regions. And so these regions are based on the U.S. Department of Health and Human Services. They analyzed the heat action plans. So Illinois would be in region 5 and Missouri in region 7. And then a table that they included was the heat action plans that included heat action strategies. So they listed the different strategies here, and then they evaluated whether the various regions represented in the study performed or included that strategy in their heat action plans. So both of these articles, I will provide the links to them below if you're interested in these topics.